Hi guys, welcome back to my channel. I am Dr. Bismam of the Endocrine Registrar working at NHS London. I am making an interview series. This is one of very common question in an interview about a difficult scenario. They can ask you that you are a registrar in acute medical unit or research. A young female trainee doctor refuses to deal with a male patient who is known rapist or drunk at the moment. What do you do? This scenario can present in different forms, like sometimes they can give you an example that drunk patient presented to you with alcohol withdrawal seizure. After having a seizure, patient was very abusive towards your female consultant, and your female consultant refused to treat this patient. What you will do in this scenario if you are the registrar on call or on take? So how you will handle this situation? So this is quite a difficult situation to deal with. We usually deal with such kind of scenarios by the mnemonic SPICE. SPICE stand for first is seek information, second one is patient care and safety, third one is taking an initiative, fourth one is escalating the situation, and fifth one is to support your colleague as well as to deal the situation as well. So always use the SPICE structure for dealing difficult scenarios, interview questions. So regarding the first part of the SPICE, it's seeking information. Although you want to find out more about the reason behind the trainee's decision, the time for discussion will come later once the immediate issue of patient care of safety has been dealt with. So information can be sought later on after dealing the patient safety, and even either it is your trainee or either it is your consultant. Just look at the situation, try to support your trainee or consultant and deal the patient safety initially. And here we need to look at if the patient is in capacity or not. If the patient is making such decisions, we need to make sure if the patient is in having full mental capacity or not. So patient care and safety. The patient is entitled to care regardless of his background. We should not discriminate the patient, and we must ensure that it is delivered by someone whose behavior is not being affected by their beliefs. There may be several reasons that the trainee wanted to refuse the patient's care, and this need to be investigated. However, regardless of the reasons, the trainee is not best placed to treat this particular patient at that particular time. We may need to change the patient to manage the patient by ourselves or delegate the responsibility to someone else. So here if it's your consultant, still we can hand over another task to the consultant or to the training colleague, and in the meantime we can take care of the patient safety. Then is the initiative. Once the patient clinical problem has been resolved, we need to organize a discussion with the junior doctor or the consultant to get to the bottom of the issue, as the decision may have consequences on the future delivery of patient's care, particularly if there are other type of patient that she finds difficult to deal with. We need to identify the reasons why she refused to manage the patient. Perhaps she or someone close to her was raped in the past. If this was the case, she may feel physically threatened even if there was no explicit threat from the patient, and would not be safe in dealing with the patient. Perhaps the patient actually made some remarks towards her, in which case she might have felt physically threatened. So we should initiate the discussion, either it is a trainee or it is consultant, to look at the bottom of the reasons. Perhaps she is simply prejudiced and is making a point of principle. If that's the case, she would likely be in breach of her duties as doctor, which requires the doctor should not let their personal beliefs interfere with the care of patient. If the trainee had felt threatened, she would need support from a senior colleague to overcome her fears and agree a strategy should the problem occur again. And lastly, if the trainee showed signs of prejudice, we would need to remind her of her duties, and would also need to report the matter to senior colleague. Next step is escalate. We need to escalate either way. This is a serious situation that could have serious effects on the trainee's mental being. Whether there has been a breach of duty or not, we should encourage the trainee to discuss the matter with a senior colleague, and if this does not happen, we should raise the matter ourselves. This is also the possibility that the patient may make a complaint, and it would make sense for senior colleagues to be made aware of the situation before the patient himself escalates it. So the last point is support. Whichever way you look at the situation, the trainee has clearly been affected by the matter, and I owe her a degree of support. If a number of staff were affected by this patient or incident, it may be worth organizing a team debrief facilitated by an appropriate professional such as psychologist. Okay, and in case if this is your consultant who is being abused verbally by the patient, then in that case we need to make and to fill out a dietetics form as well, to look at the bottom of the situation why this is happening, and we need to warn the patient in that case as well. We need to involve multiple teams in the form of nursing in charge, nursing supervisor, then the matrons, and finally the security. Thank you. That's it.